my name is Dr. Lucy Meier at Third Coast Foot and Ankle, and today I'm going to talk to you about why I brought laser therapy into our practice here in Milwaukee, Wisconsin. So I have been practicing podiatry, foot and ankle medicine for over 8 years now. And during this time, I have tried a lot of different innovative ways of treating things. There's always the standard of care, which we love, we get good results, but we can't always do standard of care with every patient, or not everybody responds appropriately to that standard of care, right? Those are all averages. We have 90% success rate, 80% success rates. And then we always have these complications and other comorbidities that we are tackling. And so there was always this portion of patients that we are struggling to treat. Now, second of all, I think our patients are starting to ask for different ways to treat things. So we really are moving away from invasive procedures and surgery and other aggressive natures to treat things, and everybody's kind of looking for a safer, more natural, maybe better researched options to treat our pain, our injuries, and so forth. And so I started researching laser therapy mostly because so many of my colleagues were using it and really having great success with it. And what I found in the research is that there's a lot of different kind of lasers. And so you have to kind of start going through and piecing through what is good and what is bad, and what the results are in all these different areas, and it can get extremely confusing. But what I discovered here with the MLS laser is that it's a very high powered laser. So it's a level 4 laser, which is about as strong as we can get, which is important because that means it can penetrate into those deeper tissues, which is what we need to do in musculoskeletal conditions. And so it's a powerful laser, but it also doesn't generate heat. And in situations where I've worked with lasers in the past, heat can cause complications to the tissue, meaning it can cause damage and maybe have some long-term effects that we didn't want or foresee. And so I really didn't want to return to using any heat lasers. So I specifically kind of was seeking out for a cold laser that was a level 4 laser, and that's what this laser is here too. Now, why is it so incredible and exciting to use? I think the thing that my patients seem most appreciative of it is that it's completely non-invasive. I mean, there is not a thing that we're poking you with when we're doing this. And so it's a great option when we're trying to stay into that conservative pathway, when we don't want surgery, we don't want injections, we don't want to take drugs and insult our body in those ways. It's a way that we can actually take advantage of our own bodies, meaning that we're taking advantage of our cells' natural pathways and how they go through the healing process. Nobody knows how to do it better than our own bodies, right? Like, we were built to heal ourselves after an injury. And so what laser is doing is just taking all of those systems that our body already has built up and making them work better and faster. So we are activating those cells in a way that makes them much more efficient. So it's like finding your best employee who does a really, really good job, and then multiplying that person and putting them on overdrive, where they're just like little worker bee doing twice as much work in half the amount of time. So that's essentially what the laser is doing in a very, very basic, dumbed down way of explaining what a laser is doing internally. So once I kind of started diving into the research and picking out and understanding what lasers are doing, what different types of lasers lead to different types of benefits, and that really exploring results with my colleagues. And that's where that interprofessionalism has become really important in communicating with other doctors that are using lasers and the types of results that they're getting. There are not only, I mean, it's one thing to just say we're going to use a laser, but there's still a technique to it, and there's treatment protocols that we have to build that are very customized customized to that patient. And so there is a learning curve for us to understand how that laser can be utilized for different pathologies, and there's all sorts of different settings we can play around with. And so after doing a lot of research, talking to a lot of people, it kind of seems like a no-brainer step once I had all the information. This is great for my patients, and it's what my patients were looking for. And so that is why I decided to introduce laser into the standard of care here at Third Coast Foot and Ankle. So if you're interested in using laser therapy for your journey with your foot and ankle, please feel free to give us a call, explore some other videos on our YouTube page, and make sure to visit our website.